It's been described as VIP medicine. You are listening to ReachMD XM 157, the channel for medical professionals. Welcome to the Clinicians Roundtable. I'm Susan Dolan, your host, and with me is Dr. Miles J. Varn, Chief Medical Officer for PinnacleCare, a professional health advisory firm located in Baltimore, Maryland. Dr. Varn, welcome to the Clinicians Roundtable.
Thank you, Susan. Thank you for having me on your program.
Tell us about the services PinnacleCare offers.
Again, as you said, it's private health advisory service, and I think a lot of people would probably say, well, what on earth is that? I've never heard of it. And the truth is we're a new concept and a new business that works for patients or consumers to ensure that they have the best resources to help them either stay healthy or to find resources if they're ill to ensure the best possible chance of a good outcome.
How did PinnacleCare begin?
Well, we started about 6 years ago in concept, and we've been operating for about 5 years. The company was founded by John Hutchins, who started and ran the international VIP program at the Cleveland Clinic and then did the same at Johns Hopkins. Although he obviously worked within very renowned institutions, he realized that there were limitations in being loyal to a single institution for all care. And his sense was that if you looked at it from the perspective of the consumer and looked only at what was best for him or her, then you would actually look at a much broader array of resources for different conditions. Hopkins or Cleveland Clinic may be the best place for certain things, but certainly not everything. So his concept was to found a company that worked purely for the patient or the consumer without geographic bounds, and that did so as objectively as possible and used the advice and direction of experts around the country to educate our members, as we call them, our clients, and to ensure that not only did they get to the best place for their condition, but also that they were well educated and that the experience that they had with a physician was more meaningful as a result.
Describe your role with PinnacleCare.
Well, as the Chief Medical Officer, I oversee all aspects of our service delivery. However, my primary role is to travel to various centers of excellence and hospitals and physicians and to meet with experts, both to let them know what we do and to ask for their help and advice and direction when we have members who have a specific problem for which they may be the perfect place. And so I guess I have a great job. I get to travel and see all kinds of health systems and meet with all kinds of physicians and learn really about what they do or what the institution does from a higher level.
Are other doctors on staff?
We have, in addition to myself, a full-time medical director whose background is adult and pediatric emergency medicine. My background happens to be family practice and adult emergency medicine. And then we have a family practitioner and an internist who work part-time, and their roles are primarily to review charts, member charts, both to organize the information and to look for obvious either omissions or kind of deviations from recommended care, just to bring to the attention of the busy physicians who are seeing these members as primary care physicians, bring to their attention issues that they may not have had time to address or were not aware of, and so forth.
How is PinnacleCare different from a concierge practice?
We work with a lot of concierge physicians, and we work with more physicians who are not concierge physicians. I think the concierge physician as a primary care physician is a great concept that, they're freed from the economic bounds of, seeing patients every 5-10 minutes, and they have the ability to spend more quality time with their patients and to be available. The difference is our scope is much broader. What we do for our members is, number one, we collect all of their medical records and we digitize them, organize them, and store them. So wherever they are in the world, we have a web-based portal that we can either give temporary access to a physician or we can access that data, whereas a concierge physician is really limited to what he or she has in their office. We also have relationships with institutions all over the country so that if we need to bring someone to, a Mayo or a Hopkins or a UCLA, that we have the ability to do so. And I think it certainly is possible, but more difficult for a concierge doctor. We also have a medical advisory board of very renowned physicians and department chairmen around the country who are willing to look at records, look at images, and give us advice, direction in terms of next steps. And then finally, we have a research department with 2 MD PhDs and 2 PhDs whose primary role is to write in layman's terms reports that help educate our members about the treatment options, the pros and cons of different conditions that they might have, so that when they see a specialist, they know a lot about their condition. They have the ability to ask the questions that are relevant. And I think the physician has the opportunity for a much more meaningful interaction, and that they have someone who knows a lot about their condition, and that experience is a lot more meaningful.
If you're just joining us, you're listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I'm Susan Dolan, your host, and joining me is Dr. Miles J. Varn, Chief Medical Officer for PinnacleCare, located in Baltimore, Maryland, discussing the professional health advisory firm. Dr. Varn, give us a success story that demonstrates how PinnacleCare works.
Sure. I'll give you 2 stories, both sort of very different in perspective, Susan. One has to do with a member who was on the West Coast and had a recurrent squamous cell cancer of the carina, which is, you may or may not know, is a very difficult place to treat. And he was actually seen in 2 very renowned places on the West Coast, was essentially told that there really wasn't a treatment option at this time. We took him to a variety of places for second opinions, one of which was the MD Anderson Cancer Center. And there they decided to use a fairly novel approach to this tumor, and they inserted radioactive beads at the site. And essentially, he's now been about 8 months out of that treatment and has no evidence of disease at this time and has every hope for a cure. So this is someone who was essentially told there's nothing we can do and is now cured. A second example is more along the lines of preventive health. We have a member who's probably not atypical from a lot of patients, overweight, blood sugars fluctuating a little bit on the high side, a little bit of hypertension, and his lipids, his cholesterol and triglycerides had been fluctuating upward. And though he had been seeing doctors on a regular basis, no one had really taken a lot of steps to tell him the meaning of that. And so we took him to a lipid specialist at UCLA who, essentially gave him the reality of metabolic syndrome and the consequences of not treating it aggressively. And for this member, his life's changed. As he says, I want to downsize me. He's become very motivated to exercise, to lose weight, to make sure that his cholesterol, triglycerides, and blood sugar are under control. And I think for any physician, we all know that the long-term impact of that is going to be significant. It really changes his life. So I think those are 2 very different examples, but they sort of illustrate what we do.
Tell us about membership. Are there different levels?
There are. I would say about 60% of our members come to us essentially healthy with no major medical problem. And with those members, our goal is to manage their health care in terms of setting up appointments and filling out the paperwork and getting them to the right doctors, and then either pulling, prodding, or helping them do the things that they ought to do to stay healthy. And some of that has to do with their medical needs, some of it has to do with their risk factors, and some of it has to do with their risk tolerance. Whether they choose to have a body scan, and there are obviously pros or cons, or different blood tests, and there are obviously pros and cons, really depend upon all of those factors. The next level of membership is really someone who may have high cholesterol, diabetes, hypertension. They have several different doctors, and they're balancing the different recommendations, different medications, and we assist in ensuring that there's a coordinated team, that everyone's on the same page, everyone's viewing the same records, and so forth. And then finally, we have a membership for serious illness. I've just been diagnosed with a brain tumor. I need help. And for those folks, we use all the resources available, our medical advisors, our connections with institutions, our research team, and we actually go to the appointments in various places, and we take notes, and we write down questions in advance, and we come up with follow-up questions, and we really kind of wrap ourselves around our member to ensure that whatever happens, whether it's an outcome that is positive, or it's an outcome that just simply is going to result in a decline and maybe end-of-life issues, that we're there to help them.
Dr. Varn, thank you so much for joining us to discuss PinnacleCare, a professional health advisory firm.
Well, thank you, Susan. Thank you for having me on your program.
I'm Susan Dolan. You've been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. We welcome your comments and questions at ReachMD.com, which now features on-demand podcasts of the ReachMD library. Thank you for listening.